Hello everyone, I'm Tiffany, Research Coordinator under Emergency Department of Baylor Scott and White Olsen's Medical Center. Our study is Alternative to Opioids, ELTO protocol in acute pain management in emergency department during COVID-19 pandemic. There was no conflict of interest in our study. With more than 750,000 people have died from drug overdose since 1999, there were over 70% deaths of drug overdose in 2019 involved opioid use. Therefore, the alternative to opioids ELTO protocol was developed, using targeted non-opioid medications to tailor patients' pain management needs and avoid opioid use whenever possible. This is the first study for ELTO protocol implementation for pain management in the emergency department. So according to different causes of pain, physicians would offer patients different non-opioid medications according to this protocol. And they found that the opioid use was significantly reduced with ELTO protocol implementation from 1.45 to 1.13 mean morphine equivalents per patient visit. In addition, during COVID, there was 1,000% increase in emotional stress distress reported to emergency hotlines. Also, in Erie County in New York, there were 85 people died from opioid overdose during the first 4 months of 2020, which was 100% increase from that period last year. But given that emergency departments have been identified as the starting point on a patient's path to the opioid addiction, our research goal was to investigate the impact of the ELTO protocol on opioid use for acute pain management under emergency department setting during COVID-19 pandemic. Our study is a single-center retrospective cohort study with annual ED volume around 50,000 patients. We collected the data among March to August in 2019 and 2020 to evaluate the opioid and ELTO medications use between pre-COVID versus COVID times. Opioids and ELTO medications were all converted to mean morphine equivalents, MME, for data analysis. For primary outcome, we evaluated the change in opioid administration, and for secondary outcome, we evaluated ELTO medication change of the administration and patient satisfaction to pain control, admission rate, ED length of stay, and the rate of left without being seen. So our study enrolled around 23,000 patients in 2019 and around 17,000 patients in 2020. And we found that the opioid use was reduced by 59.1% among discharged ED patients during COVID-19 pandemic. And also, there was no significant difference in opioid use during pandemic, which remains low with the ELTO protocol implementation. Also, for the ELTO medications, we noticed significant increase in acetaminophen use, decrease in NSAIDs and ketamine use. But overall, there was no significant difference for non-opioid ELTO medication use. For other secondary outcomes, like patient satisfaction, admission rate, ED length of stay, and left without being seen rate, there was no significant difference during COVID-19 pandemic. This is another study noted the increased opioid overdose during COVID-19 from emergency medical services data. However, there was still limited other study for the evaluation of opioid overdose during the COVID-19 times. Our study limitations included single center study, and also the design was a retrospective observational cohort study. So from our study, we can learn that during COVID-19, the ELTO protocol can keep low opioid use at emergency department setting. Also, it can reduce opioid prescription among ED discharged patients. And we will need to warrant further research for this topic to see the tendency of the opioid use and the auto medication use. Thank you so much.